Hi, it's Dr. Folakemi here. Thanks again for subscribing to my YouTube video, for liking the videos. Thank you for all the comments, all the questions. Congratulations to the people who won free skin consultations. And so today I'm going to be talking about something else that in this part of the world we are battling with, and I just, as a dermatologist who is passionate about what I do, and very sad when I see people coming with complications of this, I just have to talk about it. And I want to bust a bubble or bust a myth about some particular creams that are called triple action creams that a lot of people use when they have skin issues, but unfortunately in most cases these creams are not required, they are not necessary, and in many occasions they are harmful, particularly for those people who use these creams for their children. And I'm going to be talking about why this is so. So a lot of drugstores, pharmacies in this part of the world sell triple action creams, and these creams usually contain an antibiotic, an antifungal, and a steroid, and that's why they are called triple action. And it can actually cause problems. When you have an infection, you don't want to be putting a steroid on it most times, because steroid creams actually suppress your body or your skin's natural immune system. And this may make it easier for this infection to continue. In a way, those triple action creams actually make you dependent on them, because you have to continue using them for a longer period of time to get rid of the problem that you are trying to solve. And I think they were created by people who were just like, one of the ingredients in this will work. But as dermatologists, we advise people against the use of triple action creams, particularly because most of them have steroids that are very strong. Steroids are like, they're in different categories or classes. You have some that are really mild, and then you have some that are really, really strong, and you have some that are in between. For some reason, most of these triple action creams contain the strongest steroids, and these steroids are hardly used or hardly recommended, except for on very few occasions, because they have a lot of side effects, and those side effects are harmful to the skin. Excessive steroid use or prolonged steroid use on the skin can cause things like stretch marks, can cause skin thinning, can cause the skin to be easily bruisable, meaning that your skin can develop sores and wounds very easily, can cause the skin to become hairy where it's not meant to be hairy. That's why sometimes you see people having a lot of facial hair, or ladies having mustaches, or little children having hair on their face if their parents are using these very strong steroids, to treat them for one skin issue or the other. So it's very, very important that people do not use these creams. Furthermore, most of these very strong steroids are not recommended in children that are below the age of 12 years. But you find a lot of mothers using these creams for babies who are like 2 or 3 months old. And this is very, very dangerous, because some of these steroid creams can get absorbed into the bloodstream, because the skin of a child or a baby is very thin, and anything you put on it is absorbed into the bloodstream. So you find that a lot of these kids then may end up having the effects of these steroids systemically, not even just on the skin. So it's very, very dangerous and very harmful. I've seen children coming with very huge stretch marks because their parents were using triple action creams on their skin. A child as young as 8 or 9 years old having, terrible stretch marks on the thighs and on the arms. And what happened was because the mom had been trying to treat her for a skin issue with triple action creams, and she had been using it for over 3-4 months. So you have to be really careful with the use of such creams, and most times if you see a dermatologist when you have a skin issue, 99% of the time a dermatologist will not recommend any of the triple action creams. If what is diagnosed is a fungal infection, you'll be given an antifungal cream If it is a bacterial infection, you'll be given an antibacterial cream. Sometimes you can have a combination, maybe a fungal infection that has now developed some bacterial growth as well. So you may be given a combination of the two, but you will not need a steroid in that case. So that's where the triple action creams are actually causing more issues and prolonging skin problems, longer than they should take to heal because of the anti-inflammatory, the steroid effect. And the thing about steroids is that they give you a false sense of resolution, meaning that when you use a steroid on your skin, it gets better initially because it kind of douses all this body's natural attempt to heal that skin. So you feel like it's getting better. But after a few days or a few weeks, you find that the skin problem comes back even worse than it was initially. And that is what the triple action creams may cause. So that initial temporary improvement kind of makes people believe that, oh, this thing is working. But it's actually not working. It's like if you have malaria and you take very strong painkillers to douse the fever, to douse the headache and the body pains. You will feel better, but you will still feel worse a few hours or a few days later because you haven't treated the malaria itself. So we usually advise that you don't use a triple action cream. Sometimes our community pharmacists can recommend a mild cream for you to use, but if after 2 or 3 days that cream does not work, please try and see a dermatologist to have a proper diagnosis and treatment of that skin condition. Please do not use triple action creams on your children, on your babies. And then the mothers that are using these triple action creams to bleach their children's skin, it is child abuse. Those triple action creams are going to damage that child's body and cause a lot of complications later on. Your child is beautiful. Every child does not have to be fair or light-skinned. And because one of the side effects of steroids is making the skin lighter, some mothers now mix these triple action creams in their babies' skincare products like shea butter and use it to make the child lighter. This is doing a great harm to that child. And these days we're seeing a lot of people coming out with kidney failure, liver failure, so many issues with the skin, poor growth, and so many issues with the body, not just the skin. And some of these things may be related to some of these abusive skincare practices that are now being done on these children innocently. Why are you trying to bleach your baby? It's just a child. And those products, those triple action creams are medications. It's almost like giving your child an antibiotic to use every day. That is very, very dangerous and very harmful. So please, mothers out there, do not use triple action creams on your babies to lighten their skin because you may be harming them. So I hope that we've learned a bit about why triple action creams are not good for the skin and shouldn't be used over the counter. If you have a skin condition that is not going away, please go to a hospital and try to get an appointment with a dermatologist. There are dermatologists in most teaching hospitals around Nigeria. It may take a little while to get an appointment, but you will be able to see one. You can also see a dermatologist privately. But don't abuse your skin with triple action creams because the long-term side effects can be very, very terrible. So I'd like to hear from you what you think. If you have any questions or comments, please put them in the chat box below, and I'll see you next time. Take care.